Hello, and welcome to Breast Cancer Conversations, a podcast brought to you by survivingbreastcancer.org. I am Laura Carfing, breast cancer survivor and founder of survivingbreastcancer.org, a nonprofit organization providing community, education, and resources to empower those diagnosed with breast cancer and their caregivers from day one and beyond. Hello, my friends, and welcome to another episode of Breast Cancer Conversations. I am so glad you guys are here. I just want to make sure everyone knows that they can hop on over to survivingbreastcancer.org/events to see over 400 programs that we offer per year, absolutely free to the breast cancer community. Everything from the Breast Cancer Book Club, where we read books that have nothing to do with breast cancer, to support groups for those living with metastatic breast cancer, early stage diagnosis, inflammatory breast cancer, you name it. We also have programs such as expressive writing, expressive art. We have our poetry slams that we have once in a while. We're gearing up for some creativity challenges. So there is so much going on. So check out survivingbreastcancer.org/events and be sure also to subscribe to our weekly newsletter so you never miss a beat. Probably one of the most hottest topics we hear all the time after being diagnosed with breast cancer that is how to navigate your sexual health and intimacy and relationships after your breast cancer diagnosis.
Things with my partner are different. If your partner, or thinking about dating, like, how do I even approach dating? I want to find love. Am I worthy of love? There's all these things that come up.
Welcome to the conversation.
I'm so glad to be here. And yeah, there are a lot of things to navigate, mostly after as well. So there's cancer, there's treatment, there's if you have to do chemo, radiation, mastectomies, and then you get into this period after where the support kind of pulls back. You don't have as many appointments. You kind of miss your radiology team, but you don't want to see them ever again, So there's this period where you kind of miss those providers that supported you. And you go to having scans, every few months or every 6 months for some people. And it's just very disorienting, I found, for a lot of the clients that I work with. And I think it's disorienting because they think they should feel better about being, quote unquote, done with those treatments. Some people have immunotherapy, some people have tamoxifen that they're taking or something like that. But they're like, why don't I feel better? And my family is like, yay, cancer free. And I'm excited too, but there's also this dread or this okay, how do I move forward? My body is different. Things with my partner are different. If your partner, or thinking about dating, how do I even approach dating? I want to find love. Am I worthy of love? There's all these things that come up along with the side effects of medications, like that extreme fatigue for some people, the joint pain. And so there's so many things that impact your sexual health. And then also there's things that impact your emotional health as well. And so that is what I found in my practice working with women. And then what I did was, since I kept hearing the same things over and over, I started going to research. I'm like, is this a widespread thing, or is this just what I'm seeing in my practice? Because I'm one person, I'm not seeing a big chunk of the population, but I wanted to know if other people were struggling with sexual health side effects and just didn't have support for things that are actually treatable or manageable, in a lot of cases. So I went to research and I found that study after study, especially with breast cancer survivors, they are the ones that are most likely to have sexual health side effects. And I think that's because of the mastectomies and things like that. That's what I'm thinking. I'm not quite sure why, and I don't know if we have that answer of why for sure in research, but breast cancer survivors are the most likely to have those side effects. And so, from there, I just started to, be really awestruck, I guess, about what I was seeing in research, because to me, that means there's a huge gap. Like, you get people here, there's all this great and all these advances in cancer treatment, and they get to the point where they're cancer free, but then there's no support for them to have a good quality of life. And sexual health is a big part of that.
And when we think about survivorship, everyone kind of defines survivorship in different increments as well. I've heard 5 years, 10 years, it's lifelong, etc. And if you're on some of these hormonal therapies, some people are on it beyond 5 years. So survivorship can really be those 7, 8, 9, 10 year marks and thereafter. it's really interesting that you also bring up that this seems to disproportionately impact those diagnosed with breast cancer. And I'm also wondering, again, just anecdotally, I'm not a doctor, but anecdotally thinking if we're on medicines that reduce our estrogen levels, that directly impacts our sexual health, right? And so when we're thinking about, oh gosh, like, I never really thought about my hormones outside of like, oh yes, my hormones are crazy. This is just how I am. I used to think it was because I was a Scorpio, but no, I'm pretty sure it was the hormones. But then once you deplete all of the estrogen, that's when I also started to realize estrogen plays a really big factor in your overall well-being, not just from a sexual health, but also mental health, I think is really important. When that just drops, and we can kind of talk a little bit about this too, when this happens naturally, when women are going through menopause, that happens gradually over time. Where a lot of women who are premenopausal, unfortunately being diagnosed with breast cancer, are almost forced into this, what I'm calling a medical state of menopause, that kind of happens like a light switch. And it can be very detrimental to your body. And I'm one of those people who also gained a lot of weight while being forced to be on some of these medicines as well. And so all of these things coming together is like, getting hit by a truck all over again. You're like, okay, I beat cancer. I'm cancer free. And, especially if like your early stage as well, you're like, okay, my hair's grown back. I'm back to work. I'm feeling better, but like, I'm still not quite all there yet. And is this relatable to anyone else? Because I'm not talking to my colleagues at the water cooler about this, right? But in my breast cancer communities on our support groups, these topics come up again and again. So let's take a step back real quick because I missed all of your amazing credentials that you have. So if you want to let our listeners know a little bit about your educational background and how you got to where you are today practicing.
Sure. So I am a licensed professional counselor. I have a master's degree in clinical mental health counseling. And then after that, I did some deeper studying because I knew I wanted to go into sex therapy. And so I am a certified sex therapist through the American Association of Sex Educators, Counselors, and Therapists. So it's called ASECT. And so those are my credentials.
I mean, so we definitely have like the expert here, which I'm really excited to have. So, okay. So let's say you are meeting with a patient. Typically, when does someone start to reach out to you? Because I'm trying to think of my own experience. It was like, I just have to get through chemotherapy. I'm in active treatment. I'm not thinking about anything else. So, do you normally meet with patients when they're in active treatment, or is it usually after that piece?
It just depends. So if that person believes they need more support, they might reach out while they're in treatment. I have a relationship with the local hospital, so the patients there know that I'm available. So some of them reach out right away, and then some of them reach out after they finish things like chemo, radiation, or surgeries. But I find that a lot of people, if I look back or think back over the years, they want support while they're going through that, especially if they're partnered, because it's difficult and they don't know what to say or what not to say to their partner. They kind of just want a safe space to talk through things or to process dark thoughts that they may have and to figure out, okay, how do I set boundaries, here, and or how do I think women in general, we take on a lot. And so a lot of my clients are trying to figure out like, okay, like I really need to focus on my health and I need some support speaking up for myself and things like that. So there's a lot that goes into it. The sexual health piece is one big part, but these other things, like if you don't have the boundaries you need to have, if you're not asking for help going through treatment or things like that, that could impact your sexual health overall and your emotional health, which again goes back to your sexual health. So it's kind of this cycle of things. So I look at the whole person, like what's going on here, and then how can we support you here. I did notice that people that reach out after treatment, they may reach out, especially if they're not someone who has gone to counseling before. They may reach out if they're having trouble in their relationship and say like, okay, we're having this trouble. My libido is lower after cancer and after I finish treatment. And I'm having these issues in my relationship and I don't know how to get through it. So I find that that is a big one too, especially if the person is not, some people just, they're like, I've never gone to therapy before. I can get through, I can power through and that's fine. But that relationship piece is something that kind of trips them up. And so they might reach out then.
Sounds a little bit also like opening these lines of communication up with your partner as well, and empowering the person to share what what's working and what's not working.
Mhm.
I was very fortunate. So I'll draw upon maybe some of your experiences or some of the things that you're able to share with us that you're hearing from the clinical side. But I still have a very incredible boyfriend at the time, now husband, who was so supportive of me throughout my entire experience with breast cancer. And I know that is not everyone's experience, but even when I lost my hair, like he would like kiss my head, like nonstop, like all the time. Whether I realized it or not, it was kind of subtle, but like he would just make sure that I felt beautiful, even though I lost my hair, my eyebrows, I was bloated. I had kind of that like chemo glow going, if you will. And it just did not phase him at all. And I remember even after going through the surgery, and the very first time I had to look at my scars, he's like, "Do you want me to go in the bathroom with you? Do you want me to be there?" I'm like, "No, I think I need to do this by myself. I need to like process and see this for myself first." But then once I was ready to show him the scars, and I don't know if he rehearsed this or if he was lying or what it was, but it just like, they look great. This looks great. This was Michelangelo. Your surgeon was amazing. Like your scars looked great. And what I tell doctors this too is like, your patient isn't prepared to see the black and blue marks, right? I wasn't prepared to see the intense swelling and the trauma that happened to my skin. I don't know why I assumed I was going to wake up from surgery and just have like the scars look normal and like start to fade and heal. But to look down and just see this trauma that happened physically to my body was also a way to kind of recalibrate the expectations of what was supposed to look normal and healthy, and that I was healing on this recovery journey, despite the black and blue and all the drains and the blood and everything that was coming out. But just to have that type of support was really I was definitely at a low point, and he was just saying all the right things, which was so helpful.
Yeah, it's interesting you mentioned that because when I, again, was digging through the research, that is one of the things that's highlighted in it that helps people and helps women to heal more quickly or recover faster, or if they have that support. And it helps them with their body image too. If their partner is just doing exactly what yours did, doing exactly what your husband did. You say he was your boyfriend at the time. So that right there, I'm sure that just went so far with you where I wonder if it's almost like a security thing too. That's what I would imagine. Like, I feel secure here because there's no question, there's no avoiding looking at me, or there's no, well, I don't want to see, unfortunately, I hear that sometimes where people's partners won't look at their scars, and it just is really heartbreaking. And and I think I don't think poorly on the partner for that because I think everybody copes in the best way that they can. So I have a lot of compassion for both sides of it. And then also, it really is tough. It makes it better if the partner is supportive in that way. It's better all around.
So, what recommendations do you have for those who are listening who might not be in this fortunate situation like I was, where I had a supportive partner? But we can give a couple scenarios. So let's start with someone who is in a relationship, and to your point, like the partner might not be ready to see the scars because yes, this is hard for you, but it could also be very hard for them to understand this new life, and also understanding the sensitivity. They probably don't want to hurt you, but you still want to be intimate and touching. And so how do you help bring the people back together in this more intimate way?
No, I love this conversation because what you're describing is what happens a lot when there's not conversations about things. And so it's like both people get in their head and they're like, well, they probably think this and they don't want me to do this, or and the best thing that you can do is have that conversation. And so I always say schedule it and don't avoid saying we need to talk Saturday. Oh my God. That's even saying that, like I get exact, oh no, please don't say that. Like, tell them what you want to talk about. Hey, like, there's a lot going on. I just want to talk about us. Can we talk about us? Can we talk about our intimacy? And like really set the stage for what you're going to talk about. And then also, that also lets you prepare and lets the other person prepare. So it's not like you're going to them after work when you've been thinking about things for so long and formulating what you want to say, and then you don't get the response you want because that person was kind of caught off guard. So you definitely want to schedule it, tell them, what you want to talk about. And then when you come together for that meeting, just make sure that your basic needs are met. So you're not what's that acronym? HALT: hungry, angry, lonely, tired. So you want to avoid discussing things if either of you are hungry, angry, lonely, or tired. So HALT is a good way to remember that.
I've never heard of that, and I'm going to use that all the time. I love that.
Yeah, it's the easy one to remember because it just makes sense. It's like, okay, I need to halt the conversation if these things, because those, again, things can impact how you present and how you show up. And when you're talking about these things like intimacy, your body, sex, you want to be in a space where you can be calm. You want to be able to show a lot of empathy and kindness and not draw back from the conversation, especially if the other person says something hurtful. It's like, well, wait a minute, that I don't think you're doing this on purpose, but this hurt my feelings, or this, I didn't like the way you said that. That didn't resonate well with me, or however you want to say it, but letting them know what's going on with you so they don't have to guess, or they don't walk away from the conversation thinking, okay, that's great, everything's fine, and it's really not. So those are the biggest things, just working yourself up to have the conversation. And this is important too, and I know it can be hard because some people, like I think you mentioned earlier on, like you're just like, okay, this is uncomfortable topic for me. I don't really talk about it. And it sounds like you had some conversations with your partner, which is great. But some people are uncomfortable going that far. They're like, okay, like I really don't want to talk about this, or I don't know where to start. And that comes from upbringing, that may come from past experiences or trauma. So there's so much coming into this conversation because when you think about your sexual health or your sexual expression, it just encompasses every area just about. And so you're bringing all of that into the conversation. So you want to be kind, you want to be empathetic, but you want to be honest and authentic in that conversation as well.
Before maybe almost even having this conversation, I would imagine that there is some level of acceptance and self-love that we have to go through before we can actually open this up to our partner. Can we talk a little bit about what it is like to reestablish that relationship with ourselves, with our body?
Yeah, no, it's so good that you brought that up because I do one of the big things that I work with a lot of my clients on, and this is over the years. So I didn't mention this, but I've been seeing primarily breast cancer survivors for about the past 5 years. So I've seen about over 100 or so breast cancer survivors in my clinical practice, and then of course I have to go back it up with research because that's my nerdy background. That again, like that engineering background that I had, but the criticism, oh my gosh,
Mm,
so much work on self-compassion. And this phrase I hear so much, like I should feel this way, or I shouldn't do this, or I should look like this, or the comparison or the shoulding
mm,
all over yourself,
yes.
as that phrase goes. And so that is a big piece of it, just changing your language. And there are some practical things you can do, like affirmations, or things like I have women do some things where they identify just positive things about their body so they can say them. It's almost like you want to put in as much positive as you can to override that negative voice that's coming at you. And so the self criticism is a big piece. And I think it takes time. It takes
Mm,
time, it takes consistency. It's just a work for probably many of us just to be
yeah.
more compassionate with ourselves, especially if you're used to performing, or you're like, okay, things have to be like this, and then you lose all control when you get that diagnosis. That is
Mhm.
very, very difficult. And so then the criticism comes, and I don't think you have to do one before the other. I don't think you have to
Okay.
be at a certain point of like having self compassion or self love before you have those conversations. That can be a part of the conversation. Again, these things don't apply to situations of abuse. So these are
Mhm.
relationships where there's no emotional or physical abuse. These are relationships that are generally self and safe, excuse me, and that feel very supported. And
Mhm.
so if you have a partner like that, and like you're just missing each other, then these conversations can be important because they can support you in that. That's what the
Mhm.
hope is, that they will want to say, like, oh, I didn't know you felt like this, or what can I do? Sometimes people don't know what to do. I've heard that a lot from partners. Like, they told me they didn't want me to touch this area, or they don't want me to look here, or they don't want me to touch their breast. It hurts them, and I want to honor that, but I don't know what to do. Like, I don't know what
Right.
would be helpful. And so I think sitting down and identifying, like, what is helpful? Like, what would I want my partner to say to me? What would I want them to do to make me feel supported? Your partner was very intuitive, that he just kind of jumped in there. And some people are different. They just need more guidance, or they may have done something and didn't get the response. So they're like, okay, well, they kind of freeze up. And so it just, it's kind of like a dance with each couple, and it depends on the dynamic.
You said something that, really was like, oh, that aha moment of, I didn't know you felt this way. I think so many times we assume that the other person understands us or knows, or I thought I said something, but I really just said it in my head and not out loud. So it never actually came across. And so I think that moment is like, wow, I didn't know all of this was, going on inside of you. Thank you so much for sharing this with me. And even if I don't know how to respond right now, like, let's figure this out together, I think is really important.
Empathy goes a long way. And if there was lower empathy in your relationship dynamic before, it's really going to be magnified after cancer and treatment. It just is. And so I would encourage you to just get some support and having those conversations too. So you don't feel like you're going into them alone, and feel like again, you just don't have the support. So put as many people on your team as you can. A doctor that's trained, a gynecologist that's trained in sexual medicine, and that knows how to diagnose and treat, and it's not going to just brush you off and say, like, oh, well, just tamoxifen, you'll have to deal with this. Well, there may be some things you're going to have to just manage and get through, but then there's a lot of things that could help. And so again, all that feeds into how you feel, which goes into how you're able to show up in your relationship. And so it's really important that you take care of yourself. And again, if you need support, having those conversations, definitely get support.
I would love to talk a little bit about that too. So, like, that was just like one scenario of, being in a relationship. But let's say you're not in a relationship yet, but you're looking to date after a diagnosis. This is something that, I go back and forth with my friends all the time too. It's like, when do you share with a potential partner that you had cancer? When do you share that you may or may not be like sexually active, that you don't have a strong libido? Like, obviously maybe not necessarily the first date, or is it the first date just to get it out of the way, right? And so, how do you help women who are looking to get back on the dating scene after a diagnosis?
No, that's a good question. And that's a tough, straightforward answer. It just depends on what they're looking for when they're dating. If you're just looking for something more casual, then you might need to share some things up front. When I say some things like, hey, like, I want this to be casual. I don't want this to be serious. And, this is what's going on with me. I have these scars. I went through cancer. And so, again, only share what you need to. And when I say casual, I mean just like some people want to have just casual sexual relationships. And so you want to just share enough, especially if you're not going to be, seriously dating that person. But if you're looking to date seriously, then just like you would, in general, you're observing that person and their character. You're observing how they handle things, how honest they are, their follow through. So you want to make sure they're a person of character before you divulge like those emotionally like sensitive or deeper things about yourself. And so it's almost like, okay, let me not test, because I don't want this to sound like it's a game, but you might want to say, hey, there's some things about my health history that I really want to share with you. And so again, people think immediately STD, and it's like, well, if that's the case, then that's the case. But if it's not, just say like, there's some things I want to share about myself, then but I don't know how you react to it. I'm a little nervous about how you react. And then you can gauge, like how they respond in that way. So there are things you can do to be vulnerable. You're moving along that, Brene Brown a long time ago had some research on like shame resilience. And there was she talked about a connectivity continuum. And so on one side, there's disconnection and there's low vulnerability. So you're not sharing a lot about how you feel, what's going on with yourself. There's fear. There's fear of rejection. But then on the other side, there's more vulnerability, there's more connectedness, and there's courage. And so each time you're sharing a bit about yourself, that takes courage. And so it really just depends on where you are and the person you're dating and what you want from it. And I would say you want to make sure that this is a person that you can trust and that is of character. And don't be tied to the results. It's like it's a risk telling them, and they may say, like, okay, well, I don't know what to do with this, but that's not your person. That is not your person if they're going to shy away from something like that. Because if somebody is coming to you saying, hey, I want to be married one day, and they're like, me too, or I want to be in a long term partnership, our bodies are not machines. Things happen to our bodies, and you want somebody who is not going to just be focused on, like, oh, well, like you've been sick, or what if you get sick, or what if they get sick? Like this. So we're humans and those things happen. And so share with them, give them pieces and just see how they like manage it and how comfortable you feel opening up. But I think deeply you'll know the right time to open up more about your journey and what's happened to you.
That's such sound advice, and I love Brene Brown, so thank you for bringing up that continuum as well. Um, I just finished reading the book for our breast cancer book club where we read books that have nothing to do with breast cancer, and it was The Let Them Theory. I don't know if you read that one by Mel Robbins, and it was just like, just let them. Like, you can't control their reaction, so if they're gonna react this way, let them. Like, you can't do it. So, some of us, depending on how comfortable we feel with our own diagnosis, some of us are all over social media advocating and talking about breast cancer. And then some of us are very private about it, right? So as we're thinking now with like technology and dating apps and all these ways that people are meeting, it could be like in your profile. It doesn't have to be in your profile. If you look me up on Instagram, you're going to see that I talk about breast cancer. And I had this really funny experience talking to a colleague actually, and I just forget that not everyone knows that I had cancer. Like, I think everyone knew that I had cancer because I talk about it a lot. But again, I'm not the center of everyone's world. So it's quite possible that people know that I don't have cancer. And I think I just said something so casually is like, oh, yeah, when I had breast cancer. And the person was so like, oh my God, you had cancer. Like, I wasn't expecting this type of like compassion because it was the first time they were hearing about it. They didn't know. It was like, I just told them I got diagnosed, right? Like that whole flood of emotion. And I'm like it was just one of those like funny things. I think I say it's funny now, but like, when we're going through it and we're processing all of those emotions, but when it's the first time that somebody new is hearing this information, I wasn't expecting this flood of emotion and questions and curiosity about my experience from the other person. And of course, I was happy to talk about it. But I think to your point, Tiffany, it's like, you know, are they ready to hear it? And here I was being very insensitive talking about cancer, not realizing that there was a very emotional reaction when someone found out that I was a survivor.
For sure. And you mentioned the questions too, that you're like, oh, well, okay, like now we're answering questions and I didn't expect this because I thought you already knew. A lot of my clients, we talk about like a script for what they can say in these situations. So, we talk about, okay, what can you have ready? You're going into this situation. What can you have ready to say? And that could be anything from, I don't, yeah, I'm still working through the questions, or I'm not really talking about it a lot right now, or me and my partner only talk about those types of questions about fertility, things like that, or whatever it is. Like, just have a prepared response when you're going into something, just so it doesn't catch you off guard when people start asking questions. Because what I've found in my clinical practice and personally, when I get caught off guard and people are asking questions, I feel like compelled to answer in the moment. And it's like, I wasn't really comfortable sharing that much with them, like I didn't want them to know that. Why'd they ask me that? Like, so it does kind of catch you off guard sometimes. And a good way, again, is just to have some prepared answers to say. And then if it's somebody you're closer to, of course, you can go deeper if you want, but at least just take care of yourself in that way.
So we talked about the tools around conversation, and I love that you brought up the script too. That is just so helpful to feel prepared, whether you're returning back to work, when you're going to a family event, maybe around the holidays, and distant relatives are going to be asking how you're doing. Just having something prepared so you know what your boundaries are and what you want to share with the person, I think is super helpful. So, outside of just conversation and dialogue, are there physical things that people should be aware of in terms of supporting their sexual health?
One of the things that I hear a lot is how blindsided people feel when they didn't know their libido was going to drop, or they didn't know that they would experience more vaginal dryness, which can lead to itching or discomfort, vulvar discomfort. So they didn't know that these things were going to happen, or pain during sex. They're like, "What is this?" And so, again, as I was looking at research, a good chunk of people aren't told. Maybe 75% or so are caught off guard. They have sexual health side effects, and maybe like a third of them are talked to about sexual health side effects by their medical team. But so again, that the blindsided part I think is a big one because it's like they couldn't plan for it. They couldn't plan. They couldn't make a decision to say like, okay, before this happens, we're going to do this, or I'm going to have this conversation with my partner, or I'm going to be ready. And so those are the big ones, especially with the drop in estrogen. Just your mood might be lower. For sure, and that's definitely normal. And then a lot of people have fatigue from multiple things that may be going on in their treatment, but you might experience some more fatigued. You might experience a lower libido, lower sex drive. You might experience again this vaginal discomfort, itching, and so things like that may come up. And again, if you have a team together, like a doctor that is well trained in sexual medicine, then they can help a lot, help you navigate those symptoms.
Really helpful. I recall one friend in the breast cancer community actually had so much pain she couldn't ride her bicycle. And just, like, getting into, like, physical like, letting something go so long, not talking about it, but then remembering, like, she used to enjoy cycling, and then just being able to, like, sit on, the uncomfortable seat of a bicycle seat was just like, "I can't do these activities that I enjoy doing." Obviously, like, your joints hurt, all of these things, and then you're like, "Well, I'm gaining weight, I can't cycle, I can't do these things," and just kind of, manifests into something a lot bigger if not addressed sooner. So how would someone go about finding someone like yourself who is trained as like a sexual therapist to help with some of this?
Your primary care is a good first start. But again, like your gynecologist, who even it would be great if they had experience or training or specialty in menopause care. That's a big one to look for because they can really help you with those medications that are putting you into early menopause for some people that hadn't gone through menopause yet. And so, again, well trained in sexual medicine, knows how to treat and diagnose any sexual health diagnoses or dysfunctions that come up. And so also a pelvic floor physical therapist is will help so much, especially if you're having pain during sex. So you want to have your gynecological care. You want to have a pelvic floor PT. And again, if you're running into the emotional piece of it, because sometimes that makes all the difference between outcomes, is the emotional part of your sexual health and how you're dealing with it, or how you're not engaging treatment because you're just nervous about it or have all these ideas or cultural messages around sex. A sex therapist can help with that piece of it as well. And then, help you talk through ways that make sure you get what you need out of these appointments, and have you help you to be prepared when you're talking to those providers. So I think those three, pelvic floor PT, I think pelvic floor PT is good for everyone. I'm just like, you cancer, baby, menopause, men, women, I think, a lot of people could benefit from a good pelvic floor PT. Some actually specialize in working with cancer patients. And so that is really cool because they know certain things. They have certain trainings or they just have a passion for it. And so if you can find somebody that does have that specialty, that would be great. But I think those are a good place to start.
Super helpful. I need to look into all of these things. What haven't we covered that you'd like to share with our listeners?
I had to share this story when I was working in a different, my other field, my engineering field. I had a mentor at that time, and our section had gotten really close, and we met each other as partners. And one day he came in and he was sharing that his wife had a scan coming up. And so he shared that she had had cancer, and then it was about time for her screening, and she was terrified. She was terrified. And so, pretty much, what I found out from him is that every so often, there's this period where they can breathe and they're okay, and then when that scan comes up, he's afraid, she's terrified, and it was really robbing them of that time. And so I think one thing is just to give yourself what you need, or again, that might be therapy, or getting into a meditation practice or something like that, so that you can manage the ups and downs. Because what I've been seeing is that these side effects are things that come up, like it can catch you off guard. I've talked to people where they've been a year out from treatment, and then all of a sudden they get a side effect. And it's like, what? I've been taking this medication for a year. And the interesting thing I found was that when they reached out to the oncologist about it, the oncologist knew right away, like, oh yeah, that is a side effect. And they were thinking they were sick with this or that. And so that is very important, just to reach out if something's going on, because things could impact you. You think you're done with dealing with the side effects maybe a week or two after, or a month after, but sometimes things come up as you go along. And so having the wherewithal to just make sure that you're reaching out for support and not just white knuckling things, and trying to get through. And then also with how you're managing your emotions with it, a helpful thing is to think about your thoughts and if they're helpful to you, and validate your feelings. So these whatever you're feeling is okay. If you're feeling anxious, who wouldn't be anxious before a scan? That's normal. But when it gets over here and it's like, oh no, this is going to happen, and then this is going to happen, I'm going to have to go through chemo again, and I'm going to have to do this, then that is where you start to get into territory where making your anxiety worse and worse and spiraling. And it's just not helpful, because you can't plan for these things emotionally. You can't say, like, okay, let me spend time thinking about the worst case scenario so I'll be prepared. Like, no, if something happens, you're still going to have to work through it. So making sure that you're like, acknowledging, like, I'm feeling anxious, I'm feeling overwhelmed. Research shows that that helps you manage your emotions. Just naming what's going on, and then figuring out, like, okay, these are some thoughts that are unhelpful for me, and so I need to stay over here, with just naming how I feel versus, like predicting or doing the worst case scenario. So those are some things that I found that are helpful. Just managing continual emotions that come up, managing side effects when they come up, having a plan to navigate some of these things can help a lot.
Yeah. You brought up getting anxious leading up to your scans. And I just want to underline that a little bit, because for me, and again, you already mentioned that my husband was very intuitive. I don't know how he does this. Again, I'm just super lucky and fortunate, but knowing what your big picture calendar looks like I would be anxious and on edge and a little bit like more snappy, or a little bit more just like, challenging, I would say. But he would be like, well, obviously you have a scan next week. And it wouldn't even be on my radar. Like, how is my subconscious already getting nervous or anxious about things that were coming up? That he was just, again, he was like, this, we go through this every 3 months, Laura. Like, yes, it's the week before. Like, I get it. And I'm like, well, I don't get it. Like, thank you for being so like, being able to take myself out of my like little narrow crystal ball, if you will, but just like to see the bigger picture and kind of the external factors that might be leading to some of the emotional behavior. So I just thought, now we laugh about it because I'm like, oh yep, it's a week before. I also get this way around travel. I hate flying, even though I fly a lot. But I'm like, oh, it's a travel day, and I just block it off. It's like, this is a travel day. I get my bag of M&Ms, and anything is okay.
Nice. There we go. So you have a strategy for managing it, and that's all. It's interesting. He kind of helped you to go back into yourself. I don't know a better way to say that, but to check in with yourself to see, like, okay, what's happening, what may be going on, and yes, this is normal. Gosh, that's just like that just washes over people when I say, like, no wonder you feel like this. That is, you went through cancer. No, you don't have easy cancer. What does that even mean? It's cancer. Like, don't minimize this. This is a big deal, and this is a lot to deal with. And so that can, again, that's huge and can go a really long way.
I really enjoyed today's conversation. Where can our listeners and friends find you? I know you're on social media. Do you have a website? Like, tell us all all the ways to follow you.
Sure. I'm on Instagram at therapy with Tiffany. My name is spelled Tiffini. So again, that's at therapy with Tiffany on Instagram. And then you can check out navigatingsexaftercancer.com and you can sign up for my newsletter. I'll try to give away as many free tips or guides as I can. I have a guide up now, Rekindling Sex After Cancer, and it talks about some of these things that I discussed today. And it has like some just starter conversations, like one-liners, things you can use to start the conversation, and a couple other things. So yeah, that's those are probably the best places to find me. And yeah, you can stay up to date and stay tuned with any guides or resources that I'm releasing.
Awesome. And I will be sure to link to all of that in the show notes below. And it's been a pleasure speaking with you today.
Yeah,
Thank you.
likewise. I appreciate you. Thank you for having me.
And thank you, everyone, for listening to our show. I would like to acknowledge that all of the information on our podcast is from personal experiences and is not a substitute for professional medical advice. You should always contact your medical care team. If you are looking for specific topics or would like to be a guest on our show, please feel free to reach out. My email is laura@survivingbreastcancer.org. Our show is made possible by our nonprofit, survivingbreastcancer.org, and by our incredible donors like yourself. You can hop on over to survivingbreastcancer.org to sign up for our mailing list, make a donation, and explore the 400 plus programs we offer each year at survivingbreastcancer.org/events. Until next time, keep on thriving.